one non-prescription or non-medication thing that you can also do, which I also recommend on my fly and dive instructions, is something called ear planes. Essentially, you're trying to equalize the pressure through your natural eustachian tube. One way to kind of help with that process is to slow down the equalization in your ear canal. And so these little kind of one-way valves can slow down the air pressure from the outside world in your ear canal and allow you to try to keep up with the insufflation going through your natural vent, which is your eustachian tube.
Hey guys, Dr. Undavia, Dr. Smith, Dr. Reddy from NJENT and Facial Plastic Surgery. Today we wanted to talk to you about, we get a ton of patients that will say that they really do have a lot of ear pain or they're very muffled on planes, on ascent and descent, and we wanted to talk to you about things that you can do on your own or with the use of medications to help you, especially if this is a regular occurrence. So first, Dr. Smith, why don't you tell us what actually happens when you experience those symptoms?
Sure. So a lot of patients, as Dr. Undavia said, with flights and sometimes even like swimming deep in the pool or even when they're scuba diving especially, will get problems equalizing pressure within their middle ear. The middle ear space is a sinus, and so it connects and ventilates in through the nasal cavity. And so just like we've talked about in the past issues with sinus ventilation, that middle ear sinus can sometimes get obstructed and have issues with ventilation as well. And so that long vent that goes from the back of the nose into the middle ear space is called the eustachian tube, and different processes and different issues can arise that can cause obstruction of that eustachian tube. Usually allergies are the most common symptom that most of us throughout the year, but it can happen with viruses and other irritants too, like people who smoke or little kids that get viruses inundated throughout the school year can get eustachian tube dysfunction. So some of that can be a little bit of age. As kids get older, the eustachian tube gets a little more wider and a little more vertically pitched, and so they start to outgrow some of those things. And the irritants and viruses and allergies, those things that can trigger eustachian tube dysfunction, there are different treatments that we can do to try to get more air up into that eustachian tube. So patients may feel pressure in their ear, feeling like their ear need to pop, or they feel like it's sucked in, and they may try to open their jaw frequently to try to pop that, or blow and pinch their nose to try to get air, what we call insufflating, into the middle ear space. And so the most common symptoms would be pressure, feeling like your ears need to pop, and sometimes you can even get a little bit of a low frequency hearing loss from the eardrum being sucked back. So if you think of the eardrum as like an instrument, when that eardrum is taut, sound will vibrate that eardrum easier. If it gets sucked back, it doesn't allow it to vibrate as much and can change some of the feeling of the sound coming through the middle ear space.
That was perfect. That was perfect. Dr. Reddy, do you want to just talk about some of the things that you could do on your own to try and help that if you do get those symptoms?
So if you have any eustachian tube problems, you can try to do things to open up your eustachian tube. And one option would be trying different medications. The most common is a decongestant. So there's different decongestants on the market. One's Sudafed, the other is Afrin. And basically you can spray some Afrin in your nose right before you fly, usually like an hour or so before you're taking off, and maybe 15-20 minutes before the descent, and that'll just help open up the eustachian tube and help you equalize pressure. The other thing you can try is a steroid nasal spray, especially if you have any allergies, and that can help kind of keep your ears a little bit more ventilated long term. It may not help immediately right before the flight, but if you can plan it out a week or two beforehand, then it can be helpful. And then just like Dr. Smith was alluding to, constantly popping your ears when you're ascending and descending with altitude. And that's basically when you close your nose like this, and you kind of blow against a closed nose and you try to force air up into your ears. The medical term is called autoinsufflation, but it's just popping your ears.
One thing to note about the decongestants, so pseudoephedrine is the older school decongestant that's available over the counter. I usually tell my patients a couple hours before the flights to take 2 of the old school red tab Sudafed. Now, phenylephrine is a weaker decongestant that's available over the counter as well, and so you may see like PE listed as the decongestant. That's phenylephrine. It still works, but it's a little bit weaker of the decongestant as well. So some people that may get jittery or have side effects from the pseudoephedrine may be able to tolerate the phenylephrine. One note is that if you do have blood pressure issues or any cardiac issues, you should absolutely consult with your doctor before taking those types of medications because they can cause increased blood pressure and some other risk factors.
Which one can you use to make crystal meth?
Pseudoephedrine.
Of course, Dr. Smith would know that one. But the other thing to note is that Afrin really doesn't give you many side effects, but the Sudafed and the phenylephrine do give you side effects. You can get palpitations. So you just be aware that the Sudafed and the phenylephrine are more systemic because you take that by mouth, and the Afrin you just spray in your nose, so it's more just localized to the nose. The other thing to note is that it is much easier to equalize your ears on ascent versus descent. So when you are climbing up in the plane, you really want to try and pop your ears often because that's going to be easy. You don't want to start descent already behind the 8 ball because you're never going to be able to catch up. So use the ascent to get air into your ears because as you rise in the plane, air is expanding. It'll be easier to get into your ears. But once air starts contracting as you descend, it becomes very difficult to get the air out of your ears easily. So there's that. I wanted to talk to you a little bit about medicated nasal sprays or medications that we could do that are prescription. Dr. Reddy already talked about Flonase. It's now over the counter, but it's a topical steroid that you can do. And if you can plan your flights and you know when you're going to be flying, you can start Flonase several days before. Other nasal sprays that are available are something called azolastine. It's also a medicated nasal spray that's more like a topical Zyrtec or Claritin. That can help decongest your nose a little bit. And once in turn you decongest your nose, you can then decongest your eustachian tube. Other things that you can use are like oral steroids. Those can literally decongest the eustachian tube systemically. Again, that's usually more of like a rescue medication if you've already taken the flight, you're really congested, or you're really in pain because your eardrum is on traction. The steroids can help reduce some of the swelling in the eustachian tube, and then air can flow in between your middle ear and your nose and equalize the pressure. Occasionally, when there's a lot of negative pressure in the ear, you can draw fluid into the ear, and then that fluid can get infected, and so sometimes you need to do antibiotics.
One non-prescription or non-medication thing that you can also do, which I also recommend on my fly and dive instructions, is something called ear planes. Essentially, you're trying to equalize the pressure through your natural eustachian tube. One way to kind of help with that process is to slow down the equalization in your ear canal. And so these little kind of one-way valves can slow down the air pressure from the outside world in your ear canal and allow you to try to keep up with the insufflation going through your natural vent, which is your eustachian tube. So I typically recommend those as well prior to, especially if you have any issues in the past with flying.
Are those essentially just earplugs?
Yeah, they're an earplug, but they do have like a valve in those as well. And you can get those over the counter at CVS and Targets and big box stores and all those types of places as well.
So let's just advance let's just assume that we've taken the flight. We now have symptoms. We've tried doing Sudafed and Afrin, maybe Flonase or azolastine, and none of that stuff is working, and you've decided to see your ENT. And your ENT talks to you about what we just talked about, maybe some steroids, and that still hasn't worked. Dr. Reddy, you want to talk about next?
Yeah, so if all of the medications aren't enough and you're still having persistent symptoms, then there's essentially 2 different procedures that can potentially help. The most common procedure for eustachian tube dysfunction is ear tubes. And we have a podcast episode, I think, on ear tubes that you guys can check out if you'd like. But essentially, you're just putting a little tube in your across your eardrum, and it creates an artificial eustachian tube for your ears to equalize the pressure. And that can be done usually just in the office in a few minutes, and it's pretty well tolerated, and most people do well. The newer procedure that's out...
Wait, can I interrupt you for 1 second? With ear tubes, have you ever just done the cut and not the tube?
Yeah, so you could do just the cut into the eardrum. It's called a laryngotomy, and that can also provide temporary relief, but if you want longer term relief, you usually need a tube.
I've done it where, like, if the patient's never had this before and this is just the first time, maybe just a small cut, equalize the pressure, get rid of their pain.
Yep.
And then if it happens again, then you put the tube in.
Correct, yep. And the other option is a new option, which is called balloon eustachian tube dilation. And that's essentially when you go through your nose and you go through the eustachian tube through the nose side, and you inflate a little balloon, then you deflate the balloon, and you bring it out, and you're just trying to dilate the eustachian tube. You're trying to make your natural eustachian tube work better. And that can also potentially be helpful. It's a newer procedure with less data compared to what we have with traditional ear tubes, but the big advantage with this is that there's no little tube in your ear, and you don't have to worry about getting water in your ear as well.
Do you want to talk to them about what the procedure's like in the office?
Sure. Yeah, so with the eustachian tube dilation, typically the first thing is to see your ENT and make sure they're evaluating the nasal cavity, the nasopharynx, which is the back of the nose going up into the back of the throat where that eustachian tube opening is, making sure there's no obstructions or anything else that could be causing or leading to the issue. The procedure then, once that's all been done and everything else has been kind of been ruled out, and we know that the issue is entirely with the eustachian tube, we numb the nasal cavity up, so we use a decongestant and a mild topical numbing medication. Some of us will spray it in the nasal cavity. Sometimes we'll put a little cotton pledget in the nose first with that soaked in it to decongest and to numb the nasal cavity. Typically we'll use a stronger topical nasal decongestant and numbing medication as well. And once the nose is really well numbed, we'll go inside the nasal cavity with a tiny little 3 millimeter telescope. We take a look all the way towards the back of the nose. We evaluate and then numb up a couple little other areas in the back right along that eustachian tube so that patients feel absolutely nothing when we do this. Usually then we slide the little catheter that has the balloon on the end of it along the floor of the nose back towards that eustachian tube. Then we can actually direct that catheter with the balloon gently into the opening of that eustachian tube. At that time, we talk to patients about, we're going to inflate the balloon, we're going to leave it in there for a couple of minutes, and we're going to hold that pressure in there for a couple of minutes. Some people will experience some pressure in their ears while you're doing that, but most commonly I would say patients don't notice anything with the balloon in there. Afterwards, we deflate the balloon, pull it out, and just reevaluate to make sure that we got a good dilation in there. As far as post-care, it's pretty straightforward. Patients get up, they walk out of here, they go home. Usually Tylenol or Motrin is all that's needed for pain after that type of a procedure, because there really isn't significant pain after the procedure. Normally we have patients rinse with either saline sprays or saline irrigations like the sinus rinses to try to flush out all the stuff that we put in there to numb the nose up and decongest. And then over the course of the next 4 to 6 weeks, the eustachian tube, the swelling from the procedure and manipulation starts to kind of wear off, and we see how much improvement patients typically get, which is often significant improvement. Sometimes, and this depends on the ENT or the proceduralist, sometimes patients will have a tube at the same time, sometimes they won't have a tube. Every patient's a little bit different as far as why they need the eustachian tube dilation and why they needed the tube, so we kind of play it patient by patient as far as whether or not they already have a tube or had one recently, etc.
I think we covered almost all the topics. If you guys have any other questions about eustachian tube problems, about flying or diving, call or text us at 609-710-6673 or just email us at info@njent.com and follow us for some more podcasts.
All right, take care, guys.
Take care, guys.